So because of that, we should briefly touch on demography. It is essentially the science of tabulating births or fertility, deaths or mortality, income, and other incidents of diseases. So when this discipline first came about by Thomas Malthus, the pioneers of demography, because it was way before Industrial Revolution. It was the late 18th century. I think it was 1798, if I recall correctly. And because of that, maybe given the demands of those societies, Thomas Malthus only focused on births, deaths, income, and incidents of disease. And with the advent of technology, research and development, and other medical advancement, now researchers, including medical doctors, they had more options in terms of doing research, finding out more about the causes and risk factors of diseases when technological advancement came about. Okay, sorry, I could not make this big. So, when during Industrial Revolution, medical advancement and other technological advancement occurred in tandem with Industrial Revolution. And because of that, researchers, physicians, medical professionals, just anybody, begin to add the biological risk factors to demographic research. And initially, they developed a simpler model like this. They claim that biological factors can determine disease conditions, the presence or absence of different diseases and illnesses in a person. This in turn affects the risk for frailty, functional limitations, and organ deterioration. And this ultimately determines a person's chances of death. And at what point? Is it normal death or premature death or something else? And with more research and development, with more technological advancement from the 19th century to the 20th century to the 21st century, more and more gadgets, screening mechanisms, technology, appliances are being invented as time goes by. And because of that, people, demographers, statisticians, medical professionals, or even social scientists, just anybody, can collect more and more data pertaining to a person, whether it is the person's health behavior, like exercise, substance use, diet, or psychological factors. People can also scan a person's brain, or through other ways, to detect the person's personality, or just ask a few survey questions, however they do it. Now it's more possible with the printing press. When the printing press came about, people could distribute surveys to their target population or their sample of interest. And they could gather all this data. And there's also data on healthcare, whether people can access healthcare or not, where they live, how far is it for them to travel from their homes to a facility, among other things, the type of coverage people have. And this can be collected through surveys, asking people, hopefully, or assuming they are honest. And they are going to tell the researchers the type of coverage or health coverage they have. Or this can only can also come from hospitals' data. With industrialization, the mechanisms of collecting data and the mechanisms to develop proper databases also occurred in tandem. So I assume, and we can assume, that maybe hospitals or health facilities, they house certain kinds of data in their repository somewhere safe. And they have their own ways, even in the 19th century, to safeguard the patient's confidentiality and privacy. And we also have data on medication use. Researchers can just ask the survey respondents. Hopefully, they'll be honest, or they trust the researchers and they'll be honest. Or interviewers and researchers can also obtain this data from hospitals. So the techniques for data collection, the techniques of analysis also become more sophisticated over time. And because of that, people are able to gather or to add a biological dimension to existing demographic analysis. So as time goes by, as we can see, their models become more and more complex as the means to gather data, the means to store data become more and more sophisticated over time. And people are able to, through all kinds of testing mechanisms, procedures, scans, and whatnot, gather data on the biological risks that influence different diseases. And they have a way to store genes or biomarkers or saliva or something else in a safe place. And because of that, people are able to assess the cardiovascular risk, metabolic factors, inflammation or infection markers, or assess somebody's HbA and SNS markers, or the vitamin and minerals they take. These can be obtained through survey questions, assuming people are honest, or people or researchers can measure antioxidant stress or status through some techniques, gadgets, or other mechanisms. And there are ways to assess cognitive risk. With all these advancements, as time goes by, years or decades after Industrial Revolution, people have the means to assess all these biological risks. And there's also a way to gather data on gene expression and methylation. And because of that, it gives them a more holistic examination or a more holistic understanding and analysis of the risk for different health outcomes in terms of the different aspects of health, whether it is mortality. That's the ultimate stage of a person's health status, or the different chronic diseases and conditions, or disability, another dimension of health, or physical functioning, somewhat related to disability or frailty, or people's mental state or mental health well-being. There are ways to measure that. And we know sometimes, and it's not just that we know, it has been confirmed by researchers that health behaviors, psychological factors, healthcare factors, or the different biological risks can determine a person's health outcomes, regardless of what aspect of health we are talking about. And frailty, also related to physical functioning and disability, and mental state. And there are also ways to assess cognitive performance with all the new screening mechanisms and the new gadgets that occurred in tandem or continue to progress after Industrial Revolution. And because of that, people's model has become or is still becoming more and more complex because they assuming, and I think it's the right assumption, if they want to have the patient's best interest in mind, they are going to throw in as many factors into their models as they can to try their best to get a holistic understanding pertaining to final disease outcomes. And as you can see, the fundamental cause theory is also depicted in here. The fundamental causes like age, sex, race or ethnicity, or nativity. Nativity means whether you are native or foreign born. And other social economic statuses like education, income, wealth, occupation, and the residence. These factors, the so-called fundamental causes, do not have a direct effect on ultimate health outcomes. The fundamental causes work through intermediary mechanisms like health behavior, psychological factors, healthcare variables, and biological risk to affect the ultimate health outcome. This is also a portrayal of the fundamental cause theory.